talked a little bit about the lack of sex therapy, sexology, and human sexuality training that we receive as therapists. I went through a doctoral program and a master's program, and I received 3 hours of human sexuality training, which is so sad. Because regardless of working with sex or not, sexuality will always come into the office, especially if you're working with relationships or doing marital therapy. But more importantly, when I started out in the industry, I wanted to get an understanding of sexuality, and my first clinical training was at a sex addiction training center for 3.5 years. So it was organizations that I sought out afterwards that were able to undo the sex-negative brainwashing that 3.5 years of being trained at a sex addiction treatment center had done to my clinical brain. So that's why organizations like the Sexual Health Alliance are so important, because there's so few resources. Most of the sex training in LA, at least, is in sex addiction. So the problem was, there I am in my clinical supervision and training, and the very things that me and all my healthy friends are doing are being pathologized and called sex addiction. We were told that healthy sex only takes place within a committed relationship. That means all of us that are having healthy sex were addicted under these guidelines I was trained under. If you go into a lot of traditional couples counseling and you say that you're monogamous, no questions are asked. If you go into traditional couples counseling and you say you're in a poly or open relationship, they're like, we gotta talk about this. We think there might be some reasons or some things you're acting out. That's not okay. So the fact that I had to slowly travel the entire country to put together some kind of sex-positive training was problematic. And that's why an organization like the Golden Coast and Southwest Sexual Health Alliance bringing us education and speakers that are deeply rooted and passionate about sex positivity is so important. And to get very serious for a minute, we have a lot of organizations that are pushing diagnoses like sex addiction, love addiction. We have gay identified people in Chechnya that are getting murdered. We have people, even in our own community, that are writing books that are still shaming pornography. I just had a tweet battle earlier today with a really famous porn star who was shaming the fact that Playboy is putting a transgendered model for the first time in their magazine. We have shitty, pathetic, sad sex education that still assumes everyone is heterosexual. And monogamy is the gold standard and doesn't talk about queerdom and kink as healthy sexual expressions, and polyamory and open styles as healthy relational styles and expressions. That's not okay. We have a president that thinks it's okay to be a sexual predator. This is LA. We have people like Harvey Weinstein that thinks it's okay to spend his entire career as a sexual assaulter and predator. Yeah. We still have people that are STD shaming. We have organizations in LA that still won't talk about PrEP. And that PrEP is something that women can take, and talk about treatment as prevention. We now know that if you take PrEP, the transmission rate of HIV is almost down to 0. We know that treatment as prevention works. If you're undetectable, you can't transmit HIV. We need to talk about these things. We need to talk about the fact that a lot of us are dating online and using apps, and we still have body shaming and sexual racism. That we still have people saying things like no fat, no femmes. People that are still saying things like white only or mask only. We have so